Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department. Let's talk about this pandemic. So how best to proceed gathering this holiday season? How comfortable should you feel hosting or going to a gathering? Well, if you remember from early in the pandemic, the hammer and the dance, well, here's how to decide on the dance steps you are comfortable taking this holiday season. So please share this with everyone you care about and everyone you plan to gather with. The concern is that someone at your gathering is infected and pre-symptomatic, contagious, but before symptoms have appeared. So how can you decrease the chance of this? And if it happens, how can you decrease the chance that you or others there get infected? Well, the answer is to avoid being in close contact. Never be within 6 feet of an infected person for more than 15 minutes not wearing a face covering. Kind of unrealistic at a holiday gathering, though. So, at any gathering, there will be risk. So let's talk about what makes for a high-risk gathering and what makes for a low-risk gathering. And this way you can judge for yourself what seems acceptable or not. So here are the questions to ask. First and foremost, anyone with any suggestive symptoms agrees not to come. For sure, things like fever, cough, sore throat, vomiting, diarrhea, but also other things like sinus symptoms, congestion, allergies, things you may have had before. Any of these can be seen with COVID. And if anyone has any one of these, they will take it upon themselves to just don't go. And as disappointing as this would be, is it really worth putting your loved ones at risk, especially someone there who can't afford to get COVID? So number 2, are you gathering indoors or outdoors? The issue is possible concentration of virus in the air. The more concentrated, the bigger the viral load you are subject to. That's why outdoors is much safer. Hard to get much concentration out in the open. So if you must gather indoors, then make ventilation as good as it can be. The official recommendation is to have a MERV 13 filter in your HVAC system. Now, many home systems can't accommodate that, but they can accommodate a MERV 11. Or think about getting a portable HEPA filter unit to put in the room. Aim for 6 air exchanges an hour. That's 1 every 15 minutes. Who the heck can know that? But you can turn on exhaust fans in the house, open windows, and sit close by, especially if you cannot afford to get COVID. Generally, if you can feel air blowing around, moving around, it's probably pretty good ventilation. So the answer is outdoors if possible, if indoors, better ventilation. Number 3, how many people will be there? The issue is the more people, the bigger the chance that someone there is infected. Right now in Haywood County, that chance in a group of 10 is about 8%, meaning if you take 10 different groups of 10 people in each group, one of those groups will have someone infected there. You just can't know which group. A group of 20 doubles that chance, and go to a group of 50, and it's a 4 times greater chance that someone there is infected. So the answer is smaller is safer. Number 4, what about those who will be there? Well, the issue is people who can't afford to get COVID and can't be protected who are also there. So, will anyone be there who has health issues that put them at risk if they should get infected? And what about children not eligible to be vaccinated? Are those present fully vaccinated or recovered from COVID in the past 6 months and with evidence that they have sufficient antibody levels? Here's a biggie, number 5. Has everyone been careful in their goings about in the days beforehand? The issue is prevalence in the community matters. High prevalence increases the chance of being exposed without knowing it. Know the prevalence where you're going and the prevalence where you are coming from. So, has everyone who will be there been careful to avoid situations where they could be exposed? Crowded places where you can't know who is being careful, like restaurants, bars, games, work, driving in a car. Has everyone been careful to avoid being in close contact with anyone in these places? Kept their distance, limited time around anyone they didn't know, wear a face covering. If flying from elsewhere, well, planes are pretty safe because they have good ventilation. But what about the airports? Did everyone wear a mask and distance going through the airport, waiting for the plane? And what about driving the car with someone that you're not really sure about for more than 15 minutes? Windows down, face covering? And if you are someone who cannot afford to get COVID, what about the healthcare system capacity where you will be? In many places, Western North Carolina included, even as our case rates have fallen, the healthcare system and EMS remain quite stretched. Vaccination rates in the community matter too, because immunity in the community matters. The higher the rate, the less chance people there will be infected. In Haywood County, 90% of our cases are in those unvaccinated. Not a political statement, just a fact. Those recovered from COVID count too, of course. The majority do in fact have immunity, but not all. That's why knowing if you do not have sufficient antibody levels is important. You may be at risk, and a risk to others, more than you want to believe. So, what's the least safe situation? Several hours gathered in a poorly ventilated indoor setting with unvaccinated folks present. No one's been careful, in a community with high prevalence and low vaccination rates. What's most safe? Outdoors, everyone with immunity, everyone has been careful to avoid exposures, in a community with low prevalence and high vaccination rates. In Haywood County, frankly, we find ourselves somewhere in between, still with significant community prevalence, with good but not high immunity levels. So here's an extra measure you can take. Everyone take a rapid test 2 to 3 days before and the day of the gathering. If any of those are positive, obviously don't go. If infected but negative, what we call a false negative, more than likely the amount of virus on board in that person will still be low enough not to cause a high concentration in the air. It's not perfect, but an extra measure that can be helpful. So there you have it. What do you feel comfortable with? If you like, pause the video here. Share this with those with whom you plan to gather. Work out what everyone is comfortable with, and then enjoy a wonderful Thanksgiving and holiday season. So be well and be careful, especially right now.